Hi, welcome to the wonderful world of orthodontics. You're now on your way to a new healthy smile that will last you a lifetime. Our goal is to provide you with an extraordinary experience, but that's going to require a team effort. Your role throughout treatment is very important, but very simple. Just follow a few of our recommendations. And here's Nikki to tell you more.
Thanks, Dr. D. Orthodontics is a team effort, and to get that beautiful smile at the end of treatment, you have to take good care of your braces and yourself when you're away from our office.
The first thing to keep in mind is that you may feel some irritation in your cheeks and your tongue when you get your new braces, and that's normal, and it'll go away as you get used to wearing them. You might also feel some tenderness in your teeth, some slight movement in your teeth, and a difference in the way your bite feels, which again are all very normal. You might also have a little difficulty with your speech at first, things like slurring your S's and irritation to your tongue. But again, it's normal, and normal speech will return within the first few weeks of treatment. And if you feel any slight pain or discomfort, you can certainly take over-the-counter medicines like Advil, Motrin, or Tylenol, and that should help. Another important thing to remember is that taking proper care of your teeth, gums, and orthodontic appliances is vital to the long-term health of your teeth. So remember, you still need to see your dentist for cleanings during your orthodontic treatment at least every 6 months. But it's possible your dentist may want to see you more often than that, and it's very important to follow their instructions. Okay, now on with the how-tos, starting with the right way to brush your braces. For brushing, you can certainly use a regular manual toothbrush, or an electric toothbrush like a Sonicare or Oral-B brush will work fine as well. Remember that when brushing your braces, you'll want to use 3 different angles. Start by brushing down on top of the braces, placing enough pressure on the brush to get the tips of the bristles under the wire. Brush from one side to the other several times before you move on to the next angle. Next, brush up underneath the braces. Again, placing enough pressure on the brush to get the tips of the bristles underneath the wire. Brush from one side to the other several times before you move on to the next angle. And lastly, brush directly on top of the braces and wire, repeating this motion several times. Remember to gently brush the gum line too. That's where your teeth and gums meet. And doing that will keep your gums from getting swollen during treatment. Now, effective brushing may take as much as 8 to 10 minutes at a time, and you need to remember to brush 3 times a day, after breakfast, after lunch, and before bed. And it's not a bad idea to use an oral rinse after you brush at night and before you go to bed. You know, something like ACT, which you can get at your local pharmacy. Okay, now on to flossing. You should definitely be flossing at the end of every day, and it's actually pretty easy. To start, thread the end of your floss through the eye of the threader. Then put the stiff end of the threader under the arch wire and pull until you get a good stretch of floss. Then take the floss under the loose portion of tissue between your teeth and scrape up the sides. Some patients like to use things like super floss or platypus flossers, which again, you can buy down at your local pharmacy. These little things, called proxy brushes, can also be used between the arch wire and the braces to help loosen food particles, remove plaque, and stimulate your gums. To use them, simply push the brush gently under the arch wire between brackets. Now, if it's too difficult to push the brush into an area, don't try to force it, because you might accidentally break a bracket loose. So only use the proxy brush in those areas where you can be sure and use it gently. Okay, now let's talk about wax. Wax can be used to cover braces that are irritating your soft tissues like your cheeks, lips, and your tongue. And here's how to do it. Pinch a small amount of wax out of the package, just large enough to cover the particular brace or wire that's causing your discomfort, and roll the wax into a little ball like this. Make sure to dry the area where you're going to be placing the wax. Then just push the wax onto the area like this and leave it there. It's okay to leave the wax on your braces while you're eating for increased comfort to your tongue, but you shouldn't need to do that after the first few weeks. After that, you'll want to remove the wax before you eat and before you brush. And to do that, just lift it out gently with your fingernail. Now, if by chance you forget to remove the wax and suddenly realize you've probably swallowed it, don't worry. It's not a problem and it won't make you sick. Just remember to reapply the wax as often as needed to keep yourself comfortable or until you get used to the feel of your new braces. In addition to using wax to cover those braces that are causing you discomfort, you can use what's called a Miracle Rinse solution 3 to 4 times a day. It will help alleviate soreness and promote healing. You can make Miracle Rinse yourself pretty easily by combining equal parts of liquid Benadryl, Maalox, and water. Swish the solution in your mouth for about 30 seconds, and then make sure to spit the solution out. On rare occasions, one of your brackets may come loose from a tooth, or a wire may poke out and irritate your teeth or gums. If these things do happen, don't worry. It's nothing to get alarmed about right away. And in fact, there are ways you can fix these problems on your own, temporarily, until we can see you again in our office. We've got another video you can watch that talks all about that. It's called Emergency Care for Your Braces, and you can find it on our website and our YouTube channel. But again, remember that things like tenderness in your teeth, some slight movement in your teeth, and a difference in the way your bite feels are all very normal. And you can use medicines like Advil, Motrin, or Tylenol to help with any discomfort you may feel. Okay, lastly, we need to talk about all the things you can't eat while you're in braces. It's sad, I know, but eating the wrong kinds of foods can cause damage to your braces, which will probably make your time in braces longer. Here's what we're talking about. Hard or crunchy foods like corn nuts or nuts in general. Avoid chewing on things like ice cubes, Jolly Ranchers, Jawbreakers, Sweet Tarts, Sprees, Nerds, Tic Tacs, popcorn, Lifesavers, all that stuff. You can still eat crunchy fruits or vegetables like apples, carrots, or celery, but you need to cut them up into smaller sized pieces and only chew them with your back teeth. Also avoid any sticky or tacky foods like caramels, taffies, now and laters, sugar daddies, Starburst, Skittles, gummy bears, and stuff like that. Just like those crunchy foods, they can damage your braces and mean you'll have to wear your braces longer. Okay, having said all that, there are some treats that are absolutely okay to enjoy during your orthodontic treatment. Softer treats like Reese's Cups and Reese's Pieces, plain chocolate bars, plain M&Ms, Hershey's Kisses, and cakes and pastries and pies are all acceptable. Potato chips are generally okay to eat too. Just remember that a lot of these treats are high in sugar and you need to brush good after you eat them.
All in all, that's pretty easy, don't you think? But if after a while you have any questions, don't worry, you can watch this video anytime. Just ask us how. Right, Dr. D?
That's right, Nikki. And remember, you can ask your clinical assistant any questions you have before you leave today. And you can always reach us by phone or by email if you have any questions or concerns during your treatment. Congratulations! Let's work together to make sure you get that beautiful smile you've always wanted.